Extending Your Life Naturally says hello. Please keep your eyes on the screen. You will see hello in your language. And welcome. Welcome. So I just paused to do a personal welcome. Welcome to all the tech team and the host. Also, welcome to Sister Caroline that has been here from this morning. Sister Cheryl, welcome. Sister Edna, welcome. Elians, welcome. iPhone, welcome. Sister Joan, welcome. Sister Joan has been here from this morning from almost 5:30. Welcome, Sister Joy, Sister Classy, welcome. Sister Liliet, welcome. Sister Nala, welcome. Sister Pauline Davis, welcome. Sister Sandrine, welcome. Sister Timothy, Timon, welcome, my laughing partner. Stop laughing, Sister Timon. I see you, I hear you laughing there. Sister Vera, welcome. Sister Veronica Castro, welcome. And Sister Douglas Simpson, welcome. And we have a faithful phone call, Sister Yvonne, 1347-056. Welcome to Extending Your Life Naturally. So we have three objectives. Number one, to meet your needs and provide support. Needs and support. Number two, to draw sin-sick men and women to the man of Calvary, Jesus Christ. And number three, to provide health suggestions for educational purposes only. Question to you. Where are you linking us from? I want you to put it in the chat. Put it in the chat. Type it in the chat where you are linking us from. Thank you. Is this your first time? Please put your email in the chat. We would like to send you a soft copy of this booklet. A soft copy, My Health and the Creator. There are 8 of them. Thank you. Do you know that Han has lifestyle coaches? Please contact us at this number, 646-400-5720.
Oh yeah!
Thank you. Donation, yes, we accept donation. Please look and observe the contact information on the screen. Thank you. Thank you for staying with us as we transition into our presentation.
Good evening, everyone. It is a pleasure to see everyone here this evening. Anybody here had a tough week? You can raise your virtual hand, or you can raise your physical hand. Oh, Dr. Robles had a tough week. I had a tough week too, but you know what? It is over. Today is God's day, and I am just so ecstatic that today happened, to be honest with you. I want to welcome, I know Courtney already gave a hearty welcome to everyone, but I want to welcome everybody who's on this platform this afternoon, especially our guest presenter, Dr. Sharon Robles. She is no stranger to us. And this evening, she'll be talking about Alzheimer's. I don't know about anybody else on this line, but I know that I am personally interested in this subject because it runs in my family, especially on my mother's side, among the ladies. So I need to know what I can do to combat this disease or to avoid it. And I know some of you on the line would like to know as well. What I noticed And I'm not sure that Dr. Robles will be able to corroborate. My observation is that people are losing their memory earlier these days. I don't know why. Maybe she'll have some answers for us. So we thank you again for accepting our invitation to be here, Dr. Robles, and the floor is yours.
Okay, wonderful. Thank you so much for the invitation to be with you. Thank you. I'm trusting that everybody's had a good day. And I just want to start out with a word of prayer. Father in heaven, we just want to thank you so much for the privilege of being together. And I pray, Father, that you would use me this afternoon, speak through me, help me to be clear and understandable. And I pray that your people will be blessed as they listen. In your son's name I pray. Amen.
Amen.
All right. So I'm going to go ahead and share my screen and okay, there we go. All right. So dementia, the long goodbye. So some of you may have been with us a few weeks ago when I did part 1 of this presentation. And what I want to do now is just do a kind of a quick review of what we talked about at that time, and then move into the information I want to share this afternoon. As always, I want to remind you that the information is for educational purposes. It's not intended to diagnose or treat any condition, and definitely should not be used to substitute for the recommendations of your healthcare providers.
Dr. Robles, just a minute. Are you sharing at the moment? Because we're not seeing. Did you click it and click share? Because we're not seeing it on the screen at the moment.
Okay, hold on.
Stop share and try it again. Yes.
Okay, here. Okay. Oh, hold on. Wait, I just lost it. Give me one moment. I'm so sorry. Why didn't this come up? The blessings and curses of technology. Okay. Let's try again. Oh, sorry. I'm sorry. I accidentally closed it out and now it's giving me a hard time opening it. I apologize.
That's okay. I will ask Donnelly to keep you company.
Right. Okay, we're getting here. Hold on. Okay.
All right.
Now you're seeing something.
Yes.
Yes. Okay.
Good. Are you seeing it now?
Perfect. Let's see if okay, there we go. So sorry. Okay.
Okay.
All right. So as I mentioned, some of you were with us a few weeks ago and we did part 1. So let's review that a little bit. First of all, true or false, dementia affects memory and problem solving, but behavior is not impacted. Jump into the chat and tell me, is that true or false? Dementia affects memory and problem solving, but behavior is not impacted. True or false? What do you think? If I see false, true, false, false. Okay. All right, so I'm seeing lots of false answers, and false is the correct answer here. Dementia is a general term for loss of thinking abilities that are severe enough to interfere with daily life. Behavior, feelings, and relationships can be affected as part of this disease. True or false? Alzheimer's disease is one type of dementia. What say you, true or false? Alzheimer's is one type of dementia. Yes, and I see all the truths coming in, and that is true. There are 4 main types of dementia, and Alzheimer's is just the most common. Sometimes the term Alzheimer's and dementia is used interchangeably because Alzheimer's is the most common. And because it's the most common, most of the research that has been done in those with Alzheimer's disease. But in addition to Alzheimer's, you have vascular dementia, Lewy body dementia, and frontotemporal dementia. A few, differences between them, but ultimately the definition of dementia applies to all of them and has the same general impact. All right, true or false? Hearing loss increases the risk of dementia. Is that true or false? Hearing loss increases the risk of dementia. Okay, I see true, true, true. And in fact, that is true. That may seem like a surprising risk factor, but it's actually one of the most modifiable risk factors that occurs for dementia. In addition to that, we discovered a lot of other risk factors. So not enough physical activity, cigarette smoking, excessive alcohol use, obesity, hypertension, diabetes, and depression all increase the risk for dementia. And there are a few others that weren't on that particular slide. So we have visual impairment, low social contact, that's hugely important. Our ability to continue interacting with people over the course of life is important for keeping the mental faculties intact. There's traumatic brain injury. Any injury to the brain from accidents, from falls, whatever it may be. Air pollution and even educational level seems to have an impact. It seems as if having a higher educational level may provide some benefit in terms of the dementia risk. There are several stages for dementia that we refer to as early, middle, and late. And in the early stage, an individual can still do a lot for him or herself. They may need reminders because the daily routines may be a bit difficult. We might notice some issues with concentration. In the middle stages, more hands-on care is needed. They may get lost, and this is when you may really start to see changes in personality. And then the late stages where you have severe confusion and the person essentially needs help with every aspect of life. But I will say that the stages are not so clearly defined when it comes to real life and dealing with individuals. Each case is different from the next. And
there's
you
a
may
stain on your butt. What is it?
You may see some blurring of the lines between the stages. That is actually quite common. The symptoms definitely worsen over time. I'm muted, I think. Okay. Can you hear me still?
Yes.
Okay, all right. So the rate of progression varies from person to person. There are individuals who get diagnosed with dementia and who seem to stay in that early stage for many, many years before you notice any progression. And then there are those who seem to progress very rapidly. The average lifespan after diagnosis is 4 to 8 years, but there are individuals who live for as long as 20 years after the diagnosis. Sister Donna Lee mentioned the decreasing age at which dementia seems to be diagnosed. And there is a segment of individuals with dementia who have what we call early onset dementia. And these are people who are diagnosed before 60. I personally know of 2 individuals diagnosed in their early 50s with this disease. And while I don't know what the exact percentage is, I will say that in the medical field, we're noticing that a lot of chronic diseases are being more readily diagnosed in younger people. We're seeing it with diabetes and high blood pressure and cancers, and dementia seems to be moving in that direction as well. All right, true or false? Dementia is a normal part of aging. Is that true or false? Dementia is a normal part of aging. What do you say? All right, I see lots of F's in the chat for false, and indeed that is false. So while it is true that as people get older, there may be some issues with memory, and that in and of itself does not suggest dementia. Dementia is not a normal part of aging. This is a disease that we see, but it is not expected as part of the normal aging process. All right, true or false? Healthy lifestyle choices can decrease dementia risk by 40%. Is that true or false? Healthy lifestyle choices can decrease dementia risk by 40%. Okay, and I see a lot of truths in the chat. That is true. And honestly, what I consider the happiest slide of the whole presentation, this one right here. Just a few years ago, we were not talking about, in medicine, we were not talking about healthy lifestyle choices and dementia. But it's really good, really encouraging to see the science catch up with what we have been told in the Word of God and in the spirit of prophecy. And our lifestyle choices have a significant impact on our daily lives. And it means we have a choice. And it always feels good when you have a choice about what's happening with you. So great. Okay. Here are a few of the lifestyle choices that have been highlighted in terms of research. So controlling high blood pressure and actually controlling blood sugar, hugely important. We know that people with diabetes have a much higher risk of developing dementia as compared with the general population. So controlling high blood pressure and controlling blood sugar, very, very important. Sleeping well, getting enough rest. Some of you may remember that I talked about the fact that in Alzheimer's, the problem is you have these proteins that are supposed to be there in your brain, which start folding in abnormal ways. And when they fold in abnormal ways, they kind of get stuck in the brain. At night when we sleep, our brains actually shrink just a little bit, creating pathways for the body to remove these proteins from out of the brain. And so when we don't get enough sleep, we deprive our bodies of the chance to do the kind of repair work that it needs to do throughout the body, including the brain. Eating a healthy diet, always important. And we know that the healthiest diet we can eat is the diet that the Creator gave us in the beginning. And I know if you are part of the Extending Your Life Naturally family, you hear about the laws of health all the time, which includes physical activity and rest. All of these things are important. The research is showing us in terms of decreasing dementia risk. And then, as I mentioned before, social contacts, connecting with family and friends. Sometimes as we get older, perhaps after leaving a job and not really doing much thereafter, our contacts start to decrease. And this is a good time to remind us that even if we've retired, it's important to do things that will keep the mind healthy. So look for opportunities to volunteer, do lots of reading, learn something new, learn to play an instrument, learn a new language. Those kinds of activities help to strengthen the brain. Another good choice for building up your brain function and keeping it strong, memorize scripture. Good way to engage your brain and keep it healthy and strong. So going now into the second part of our presentation, you may be wondering, if you think someone is developing dementia, a loved one, you want to know what to look for. And so here's just a short list of some of the things you should look for that might signal you that something is happening. So difficulty with everyday tasks, right? You're noticing that an individual's having trouble putting on the socks and the shoes, or can't seem to get the right shoe on the right foot, that kind of thing. Repetition is one of the things we probably recognize first or earliest. People who are repeating themselves over and over again, telling you the same story, asking you the same question. Communication problems in general, getting lost. An individual who, let's say, has lived in a neighborhood for the past 30 or 40 years, and now going to the store 2 blocks away, that person gets lost. There's a sign that something is wrong. Personality changes. The person who's usually very calm and quiet is now yelling and angry and always irritable. Confusion about time and place. I can tell you that when people retire, for example, it becomes a little more challenging sometimes to remember what day of the week it is. That's not so odd, but if the person's really confused about the day, so for example, let's say you have someone who is a Sabbath keeper and goes to church on Saturday. And then Sunday comes, but they can't tell you, even though they went to church yesterday, they can't tell you that today is Sunday. That might be a trigger. Misplacing items is another common thing. Troubling behavior in general, and just kind of a loss of interest in the things an individual enjoyed. Maybe this person enjoyed singing. They're not singing anymore. Maybe this person enjoyed going outside and taking long walks, and they no longer want to do that. Now, I can tell you some of these things that I've mentioned here, you can see with other conditions. For example, depression is a good one. And we mentioned this at our last time together, that some aspects of dementia mimic other diseases like depression. So it becomes really important that when you're seeing these things, that there be an evaluation about what's going on. If you're noticing these changes, you want to educate yourself about what's going on with this person and about diseases like dementia, as we're doing this afternoon. You also want to take some time to observe the individual. And actually taking a few notes is not a bad idea. On X day at X time, this happened. Those notes will serve you well later when you have a chance perhaps to talk with medical providers. And then you also want to pay attention to if something else is going on. Again, for example, let's say that there's a couple that's been married for the past 60 years, and the wife passes away. And now the husband seems to be struggling, almost, all of a sudden. Everything seemed to have been okay. You have to realize that grief may be playing a part in what you're seeing. So those kinds of things you want to pay attention to. Talk to other loved ones, neighbors, friends, church members. Has anybody else noticed that things are changing? And then you want to have a one-on-one conversation with your loved one. Now, that's not necessarily an easy thing to do. And don't be surprised if there is some denial around what you may be suggesting. You want to make sure, though, that if you're going to have a conversation about something like this, that you do it at the right time, when the person is not tired, not feeling overly stressed, and in the right place. Someplace private would be ideal. In general, you don't want to have, the whole family approach an individual with this. That would be overwhelming. But take time to talk about what you've seen. And if you're concerned about what you even say, you can say things like, for example, I noticed that you were having a little trouble with X. Has this happened before? Have you been worried about that? Or anything else for that matter? Or you can say you've seen something that worries you, and that you want to make sure that your loved one is okay. One of the things that you want to do, if the person has heard you, that's great. Sometimes more than one conversation will be needed in order to get to the point where you can offer to go along to a medical visit, so that you can discuss your observations with the healthcare provider as well. If you're dealing with someone who's in complete denial and doesn't want to hear it, you can still reach out to your loved one's primary care provider and share what you've observed. Now, the healthcare provider is not going to give you any information. If a diagnosis has already been made, none of that is going to be told to you unless that has been prearranged. But I can tell you, as a healthcare provider, it's helpful to me when loved ones share what they've been seeing, because in those 15, 20-minute visits that we have, especially in the beginning of something like dementia, I can't necessarily tell that anything is wrong. And so, don't hesitate to share what you're seeing. Now, what do you do if you think you're noticing some changes in yourself? Go ahead and make a list of what you think is changing. And then you want to go and see your doctor. I know that all of this can be a bit frightening, and sometimes people hesitate to talk to the doctor because they're fearful about what the end result will be. But as with any chronic disease, the earlier we know what's going on, the better. It allows us to plan and do whatever treatments are available, etc. Identify a trusted family member or a friend who can be with you to give support as you go through this. And if you're being treated for any chronic diseases, kidney failure, heart disease, diabetes, high blood pressure, continue to those medications and whatever treatments you're getting. Again, a number of these chronic conditions, when they're not controlled, actually contribute to making dementia worse. After a diagnosis has been made, you've got to give yourself, if it's for you, give yourself and everyone else some time to adjust, right? This diagnosis is, as I said, difficult to hear and leads to a major change in life for the affected person and for those around that individual. It's also time to start building a support team. For the most part, when the dementia diagnosis is made, it's early on in the process, and the affected individual can still contribute a lot to what they want and what they don't want. This is the time to start putting things in place. So building a support team of family members and friends and even neighbors who can stand in the gap as needed, that's important to do. And then creating an action plan, right? There's some things that need to be taken care of. Dementia is a progressive disease, and whether it progresses slowly or quickly, there are some things that need to be looked at. One area that you want to address is healthcare planning. So having insurance, having health insurance is hugely important, makes it possible to follow up with your healthcare providers and get needed treatments. But in addition to that, individuals need to have what we call advance directives. And these are legal documents that will detail your wishes, but it only goes into effect when you can't make decisions for yourself. And unfortunately, for people with dementia, if they live long enough, they get to the point where they're not able to make their own healthcare decisions. And so you want to know that an individual or individuals have been chosen who can make decisions for you if you can't do that for yourself. One form that you've probably heard of is the healthcare proxy form. It's also called the durable medical power of attorney form. And this just a form that allows you to choose an individual to make medical decisions for you in accordance with your wishes if you're unable to do so. So this form presumes that you've chosen somebody with whom you will share your wishes and who you will update from time to time if necessary, if you've made different choices about what you want to happen to you later on in life. The form allows you to choose an alternate person to act in your behalf if the choice number one is not available. And at least in New York State, you need no lawyer or notary to do this form. You can actually download it off of the internet, but it does need to be signed in the presence of 2 witnesses. And here's just the top part of the first page of the New York State healthcare proxy form. And you can see here that, it gives you the opportunity to put in the information about the individual who you're choosing and an alternate, and then ask several other questions, and then it should be witnessed. One thing I must say to you, hugely important that you speak to the person who you've asked to be your healthcare proxy. That person should be aware. A few months ago, I met a lady who used to attend my church, and she said to me, "Oh, I'm so glad to see you." And then she says, "Oh, I put you down as my healthcare proxy." And I thought, okay, but we've talked about nothing. We've had no discussion. So I had to make arrangements to find out from her what her wishes are, because that's an important part of this. You may have also heard of a living will, which is another legal document which allows you to actually tell your healthcare providers what your preferences are. So the healthcare proxy is an individual with whom you've discussed your preferences, but in a living will, you can actually list your preferences concerning end-of-life healthcare. And I'm sorry, this is not the clearest copy, but this is just part of the New York Living Will page. And it's pretty simple. You just fill in your name here, saying that you're of sound mind, and that you're giving this information regarding your health care under certain circumstances. And it lists the circumstances, right? So it's really about whether or not you want treatments to sustain your life. And you can choose to check A and say, I don't want my life prolonged, which would mean you don't want CPR done. You don't want to be on a ventilator. You don't want artificial nutrition or hydration through a tube, et cetera. Or you can choose to prolong life. And on the next pages, you can say what you agree to. For example, you may decide that you don't mind being on the ventilator, but you don't want cardiac resuscitation. It's all up to you. It's excellent to actually have one of these forms and have a discussion with your own healthcare provider, so that you're understanding all the options and you make the right decisions. And of course, you have the right to change this at any time that you want. Ideally, you should have both a healthcare proxy and a living will. And what you discuss with your healthcare proxy should match what is detailed in your living will. For example, your healthcare proxy, that individual shouldn't think that you don't want life-sustaining treatment, but your living will says that you do. A living will is legally binding and must be followed, and your healthcare proxy cannot override what you've put in the living will. Again, just emphasizing the importance of making sure that your living will and what your healthcare proxy has been told is all on the same page. All right. Financial planning is also hugely important for people in general as they're getting older, but especially for people with dementia. So the statistics tell us that 80% of people aged 60 and over do not have the financial resources to cover long-term care services or another financial shock. So there's got to be some planning. You already know what a will is. It gives details on what to do with your property, your money, other financial assets at your passing. But it can also address end-of-life arrangements like funerals and burials. But it's a good idea to have what's called a durable power of attorney for finances. This does not have to be the same person who is your healthcare proxy. They can be different people. But this would be someone who would be responsible for handling your finances if you're not able to do so in a proper manner. You also want to understand, what's happening with insurance. And what's important about that, for example, is that if you can have a very good health insurance, but most health insurance will not pay for example, home care services, or will only pay for a certain amount of time in a nursing home. After that, you would need, in New York State, you would need to have Medicaid to pay for home care services for long-term care, for example, in a nursing facility. So that's something to keep in mind. When it comes to home care and where you're going to be, where you're going to stay, you may be at home and maybe even living alone, and that may work for a time, but you have to understand that, again, with this progressive disease dementia, the time will come where living alone won't be safe. And it may not even be safe or convenient, even if you're living with others. Very often the people you're living with may be going out to work or school every day, or maybe they are elderly individuals who can't give much assistance themselves or need their own assistance, all right? Then there's assisted living, which is an option, but is also quite expensive and is often not paid for by regular insurance, and nursing homes. But just something to think about as you're planning, that, an individual with dementia won't necessarily be able to stay in the home that they've grown accustomed to. The sad part about that is that people with dementia tend to do better in familiar surroundings. But of course, safety is a priority, and sometimes that can't be done. Some other things to think about is, having discussions early on with your loved ones once a diagnosis is made. And then starting to gather up this paperwork, so the healthcare proxy and the living will, and making sure that there's some trusted person who knows where to find these things. Sometimes we have it all. We have the life insurance policies, and we've got everything, but there's no one place in our home where it is, and there's no one person in the family who knows where to find it. And some of you may have had the experience of going through this, having a loved one, let's say, get sick, or even pass, And now you've got family members in the home searching through every drawer and every stack of papers, trying to find what's needed. So organizing the important documents in one place, clearly identified, is an important thing to do. And then you want to update your documents as needed. So you may decide you want to change your healthcare proxy, or maybe the individual who was your healthcare proxy is no longer able to fill that role. You want to do that. And then ideally, you should give your healthcare providers advance permission to speak with someone who you trust. Spouse, your children, a niece, a nephew, a close friend, whomever it may be, someone with whom the healthcare provider can speak openly. You've probably heard about HIPAA laws. We can't just share your medical information with someone because they happen to be your next of kin. And so giving that permission can often make things a bit easier as time moves on. If you live alone and you've been given a diagnosis of dementia, first I would suggest learn to ask for help, learn to accept help. Some of us are especially bad at doing those things. Dementia is not the kind of condition that you can or should tackle by yourself. So definitely, learning how to ask and accept help is important. Create easy access to the names, phone numbers, and relationships with your support team members. So for many of us, I know that's my situation, or had been, my whole life is in my phone. All the names, all the phone numbers, it's all there. But for someone with dementia, making their way through the phone may get to the point where it's not so easy. And actually during the pandemic, what I did is I went old-fashioned. I actually purchased an old-fashioned address book, and I started writing down the names and phone numbers in that address book so that I have another way of holding on to those numbers. It's also a good thing to have in case there's a loss of power and for some reason you can't charge your phone. But for someone with dementia, sometimes hanging these things on a wall where it can be easily seen helps them a lot. So that's one thing you can do. Consider having an emergency response system similar to what's displayed here. This is one of those devices that you wear around the neck. And if something is happening, you're not feeling well, you fear an intruder, whatever's going on, you can press that button and it immediately connects you to emergency services. Good thing to have for people who live alone. Home safety evaluations are important as well. This is the kind of thing where, again, in New York, for example, visiting nurse service can come out and check your home to make sure that you can move around safely, that you don't have loose rugs or cords that might cause a trip hazard, that lighting is adequate, that you have a nice solid rail to hold on to if you need to ascend and descend steps, things like that. And then, of course, recognize that living alone may not be the safest option for you. Investigate other options. Many of us are probably familiar with what we call the medical alert bracelet or necklace, which has some medical information on it in case there's an issue. Well, years ago, the Alzheimer's Association linked itself with Medical Alert and created what is called Safe Return. And this was specifically designed for people with dementia who may leave home and get lost. It's a great thing to have. If you have a loved one who still moves about on their own or who sometimes escapes from the home without anyone knowing, having this information on them in the form of a chain or a necklace or bracelet or a necklace can be very helpful, because they just have to call the number on the bracelet and they get all the information, including where the person lives and who their contact person is. So something great to consider for those individuals. If you've been diagnosed with dementia and you're still in the workforce, that can be a pretty frightening situation. For most people, you wouldn't want to tell everybody, and your fear would be that people would just find out. What I suggest is that if you're having difficulty with performing your job, you can consider making some changes. You can see if reducing your hours is an option, or switching to a less demanding position. In some cases, depending on the kind of job you're doing, it may be necessary for you to leave the job. But you want to have that discussion with your employer before you just decide that's what you're going to do. You can talk to Human Resources and the Employee Assistance Program to find out what's available to you: family leave, disability, and other benefits. And you can even check with Social Security to see whether or not disability benefits are available to you. Just a reminder, one of the most loving acts you can perform for your family is to plan for your future. Sometimes people are afraid to make those plans. Some people believe that, well, if I start planning for the end of my life, it's going to come sooner. That's not really the way it works. And if you've ever been in the position, as I mentioned, where you have a loved one who's suddenly sick or who suddenly passes, and you now have to find all that information, you recognize that it's really a great blessing to have all of that at hand during those stressful times. Now I just want to spend some time talking to caregivers and anybody who might be interacting with individuals who have dementia. And the information I'm going to share, not all of it applies to every stage. It will depend on how good the person is. But I hope you'll find something here that you can take away and use. There are over 11 million individuals who provide unpaid care for loved ones with dementia here in the US. The typical caregiver is a middle-aged woman, usually a daughter or a daughter-in-law, and often is still employed. So this is someone who leaves job number one and comes home to perform job number two. Nearly a third of these people provide 20 plus hours of care per week, which is a lot if you're a full-time worker outside of the home. So are you a caregiver? Well, do you call to check on someone? Do you take anybody to appointments or to run errands? Do you remind them to take medications? Do you help with the bill? Do you cook for them or help clean the home? Do you pick up their prescriptions? Do you monitor their eating habits? Are you doing the laundry? Do you take them to church? Are you doing safety checks at home? Are you doing yard work? Are you doing the home repairs? Are you walking the dog? If you answered yes to any of those, you are in fact a caregiver. Now, you may not be the primary caregiver, but you are in fact a caregiver. So here's what we want to do. We want to be realistic in our expectations for ourselves and for those who we love, who may be dealing with this disease. Have to be patient, set realistic goals, and learn to expect the unexpected, especially as you move into the middle and later stages of this disease. Plans are often upended because from one day to the next, you're never quite sure what the temperament might be of your loved one. So you've got to kind of be prepared for that and be willing to adjust basically on a dime to make sure that things move forward in the best possible way. When possible, develop predictable routines and schedules. This can help to decrease confusion and frustration for your loved one. Most people with dementia don't do well when you shift suddenly on them. So, Try to be as predictable as possible. Realize that the memory is not good. So, for example, maybe you told Aunt Mary last night before you left that you were coming to pick her up in the morning to take her to the doctor. It does not mean that Aunt Mary's going to remember that tomorrow morning. So you may need to call Aunt Mary an hour or two before you go to pick her up to make sure that she's up and that she's getting dressed. Even after you do that, when you get there, Aunt Mary might have gotten distracted by many other things, and maybe she's done nothing. You kind of have to prepare yourself for how you're going to deal with those kinds of situations. Do not argue with your loved one. This just leads to frustration and makes everything more difficult. You want to choose your battle, so to speak. So not everything needs to be corrected. Some of us like to be right all the time. And that's something you're going to have to let go of when you're dealing with people with dementia in general. Some things just don't have to be corrected. If Dad says we went shopping yesterday, but it was really last week, it's probably not important that you correct that. And if you try to correct it, you might find yourself in an unnecessary argument. So learn to let some things go. Something else you want to try to avoid is saying, "Don't you remember? Don't you remember I told you that 5 minutes ago? Don't you remember that we did so and so?" So that causes a lot of frustration for someone who actually doesn't remember. And can really make them feel very bad. And then that goes on to affect their behavior, for the next several hours. Remember that each person is unique. Behaviors are a form of communication. So you want to learn to read your person if you don't already know how to do that. And even that will have to be adjusted because their behaviors are changing. People with Alzheimer's maintain the ability to understand nonverbal long after the verbal is forgotten. So our tone, pitch, our gestures, our facial expressions, if you grab them harshly, those kinds of things are remembered. You want to be calm and gentle in speaking. Call the person by name. Identify yourself. And, try not to be offended if someone does not remember you. It could be a parent, it could be a sibling. It can be hard to take, but realize that it's the disease that's doing it. It's not your loved one. This is what the disease has done. Use short sentences and try to speak slowly. Always be respectful. Eliminate distracting noises. That can be very disorienting for people with dementia. Use familiar words, give simple choices, give one instruction at a time, and most importantly, allow time for response. Yes, maybe you could get it done in 30 seconds. It might take your loved one 5 minutes. And if you try to rush them, all you're doing is causing frustration. Encourage healthy lifestyle habits. This can sometimes be easier early on in the disease. Sometimes, people get more combative, and even the person who is practicing healthy lifestyle habits may give you a hard time about going for a walk or drinking water, but encourage as much as you can, as lovingly as you can. Give as much independence as possible, as much independence as you can safely give. So, for example, if your loved one can still dress himself, allow him to do that. If that individual can still pick out their own clothes, let them do that. Now, maybe you don't like that skirt with that blouse, but especially if you're just going to be at home and no one else is seeing this, then just allow the person to do it. Giving up independence is a very hard thing for us as adults. And early on in this disease, when the person is aware of all that's happening and they understand that they're more forgetful and they're not as good at doing certain things, if you take away their independence from them completely, it's quite crushing. So allow them to do what they can do. You may have to start the activity. So let's say you're washing clothes. You may not allow that person to actually pour the detergent, but you might allow them to actually put the clothes in the machine, and maybe you pour the detergent into the cup and hand it to them and let them do it. People like to feel useful at any age. Respecting privacy, also important. If you're picking up the mail, as long as that person is still aware, don't just open everything up. Ask for permission to open the mail. If the person is getting dressed, you can, if you can safely do so, walk away and allow them in privacy to get dressed. And then check back with them and say, do you need any help with anything? Those kinds of things really help. Look for the opportunity to engage in activities that your loved one still enjoys. And even consider trying some new things if you think the person can handle it. As a caregiver, especially if you're the primary caregiver, just once again, in a place that's easy to find, maintain a current list of medical problems, medications and doses, allergies, doctor's names, phone numbers. If you're in your loved one's home, it doesn't hurt, for example, to even put the address up somewhere nearby. If, for example, you need to call, someone needs to call emergency services. Sometimes we don't remember the house number or the building number, and just seeing it there makes it easy for someone to look at. The main contact people and their phone numbers, having it right up on the wall somewhere or on a board that you've hung, a cork board. Just make it easy for yourself to get that information that you might need quickly. Learn to love your loved one the way he or she is right now. You can miss the person he or she was, but it's important to show your love and care for the person as they are, whether or not they can do what they used to do that you so enjoyed. And then be deliberate about spending time. It's interesting, I noticed that for a lot of older people, whether they have dementia or not, they really appreciate having someone just sit with them, hold a hand, put your arm around them, and just let them talk. And honestly, even if you've heard the story 50 times already, go ahead and listen one more time. I promise you, unfortunately, the day is going to come where you do almost anything to hear that person tell you that story again. For caregivers, especially primary caregivers, I can't emphasize enough the necessity for self-care. Usually, the caregivers, ignore their needs and focus their attention on the person they're caring for. It's important that you find a way to let go and make sure that you have some time to yourself to recharge so that you can continue to give the best care. And of course, you want to pray for supernatural strength, because that's what you need to deal with this disease at every level. Pray and ask God to give you strength and wisdom and courage, and to send the people that you need when you need them. There are several resources that can be helpful when a dementia diagnosis is made. The primary care provider, of course. Find out about the Family Medical Leave Act, which can give you some freedom to adjust schedules at work and give more attention to your loved one. Check for services that might be covered by insurance, like respite care, where it can be arranged to have someone come in for a few days to be with your loved one, to give you a break. There are support groups, the Alzheimer's Association, and the National Alliance for Caregiving are great resources. You can find information about all of these online. And I just want to end with this poem that I love, and I think is very telling about what dementia must feel like. It says, "Do not ask me to remember. Don't try to make me understand. Let me rest and know you're with me. Kiss my cheek and hold my hand. I'm confused beyond your concept. I am sad and sick and lost. All I know is that I need you to be with me at all cost. Do not lose your patience with me. Do not scold or curse or cry. I can't help the way I'm acting. Can't be different though I try. Just remember that I need you, that the best of me is gone. Please don't fail to stand beside me. Love me till my life is done." All right, thank you very much for your attention, and I'll be happy to take questions if there are any.
Thank you so much, Dr. Robles. That was really, really informative. It is true that some of these things we don't think about, but we need to be thinking about them. For those who have questions, would you please put them in the chat? Or you can open up your mic and speak.
Good evening, doctor. Do you believe that Alzheimer's can be reversed?
Anything is possible with God. I have not personally seen it reversed. I do think that healthy lifestyle choices can perhaps slow down the progression somewhat. But I have yet to experience someone having a reversal of Alzheimer's. And honestly, with what we know about dementia and the damage that's done in the brain, it would require God's supernatural intervention to repair the damage that occurs.
Anyone else? Oh, go
because
ahead, sister.
on the internet, many times I saw a lot of program how to reverse Alzheimer's, and what they are suggesting is a little bit about the 8 laws of health, mostly exercise that help, and also to cleanse and detox, because they said that it is also from the damage that what we are eating, everything that we are saying as a health medical missionaries, and to detox the person, and to have special detoxifiers like pelvic acid, and all these kind of things that and they give all the B complex and all these things to really cleanse the person and to reverse it. So I didn't see one yet, as you said, myself, but this is what I was watching, what they were saying. This is the experience that one doctor had from her husband that had Alzheimer, and she tried coconut oil and plus other things, and she saw the improvement and a lot of things that happened with her husband. So these are the case maybe, as you said, it can be to retard it, but this is the hope that is out there.
Yeah, I heard about the coconut oil as well. I would love to know if anybody ever had success in reversing it. One of the challenges with pretty much with all chronic diseases, including dementia, is that the changes in the body start taking place long before the signs and symptoms of the disease appear. So, for example, when it comes to Alzheimer's, we know that changes can start in the brain 10 years before the person actually starts showing any signs or symptoms. That's quite a head start that the disease has before we know something is happening. And so I like to encourage people on focusing on the prevention piece of it, because that's where I think we can have the greatest impact in terms of lifestyle choices. Once a person has dementia, and especially once that person leaves that early stage, it becomes much more challenging to get the person to do certain things. Yes, taking a walk every day is good, but if that person doesn't want to walk, there'll be no walking taking place. Yes, they should get to sleep. You put them in bed at 9 o'clock. At 10 o'clock, they'll be up and walking around because they're up and because the brain is not functioning normally. So it really is a challenge. But as I say, who knows what God will reveal to us. Going forward, that I would love to see there be something relatively simple that we could do to reverse dementia. That would be awesome.
Thank you, Dr. Robles. There's another question in the chat. How often did you see dementia in your diabetic patients?
Ooh, wow. Hard to answer.
If I could read her mind, I think they're saying, I think we've been taught that dementia is type 3 diabetes or something.
So yes, dementia has been called type 3 diabetes by some. And that is because the same issues with insulin resistance that you see in the other cells of the body, we also see in the brain. And we do know that people with dementia, people with diabetes, as I mentioned, have a higher risk for dementia. But in terms of how much I've seen, it's it's not going to be a truly reflective of what's necessarily happening in the general population, because I probably saw a lot more diabetes patients than the average person. So I was also seeing a lot of the worst diabetes patients. But I guess it's pretty safe to say that maybe most of the patients that I had, and I'll say maybe 60% of the patients that I had who had dementia were people also suffering with diabetes.
Okay, that's great to know.
Dr.
Like you said, because you're basically working with diabetic patients, it's hard to tell when you compare it to what's happening in the general population.
Use everything, right?
Yeah.
And as a consultant, seeing the worst of the people with diabetes as well. So unless you do a real study, you don't know, right? Because they have diabetes and they have high blood pressure and they have heart disease and kidney dysfunction, so many things in that one bowl. So a little hard. Yeah.
My grandmother has dementia, but the things that I have suggested, the caregiver, she's not consistent with them, because I was very curious to see if the coconut oil, the MCT oil, and those kinds of things, the B vitamins, and those foods that are rich in B vitamins, if they actually work. But my grandmother is very difficult these days, so I don't think I'll ever be able to make the comparison.
Yeah, it's challenging. And you know what? The way dementia affects each individual is so unique, really. How they respond, how much brain function they retain, those kinds of things. It varies so much, even though we're going to be talking about just a handful of diseases that fall under this one umbrella. I think it's even hard to study that kind of thing. That would be challenging. But
Yeah.
maybe someone will figure that out.
I have a comment and a question.
Yes.
Go ahead.
Hi, Dr. Robles. This is Sister Cook. How are you?
Fine. How are you?
Wonderful. Well, first, I just wanted to say that I am experiencing that right now with my mom. She has dementia, and I'm so happy that I tuned in. One of my questions was going to be, is Alzheimer's and dementia used interchangeably, or is one like an extension of the other, or how does that work? Because for years I've been conflicted with this here. The other thing is the doctor that the sister spoke about, I saw that as well. And I started giving my mom the coconut oil, and I did see improvement. And I wasn't giving it to her every day. She was able to call me by my name, which she had not done in over a year. And with that, and this is her seeing me. When she heard my sister on the phone, she called her by name. We were shocked. So I have to attribute it to that, but also I have been giving her like liquid nutrients and things like that, which they had said, that it wouldn't help her, but it helped, believe me. They don't always allow you to, they don't want to tell you the truth. They had given up on my mom. And so I was like, and I asked the doctor about liquid nutrients. He's like, oh no, that's not going to help her. She's just that. But I went and I found some liquid nutrients in the health food store. And so what I do is I mix that with also the coconut oil. And yes, I have seen improvement in my mom in terms of her memory and her recollection of stuff. My other question is, does with trauma to the brain affect the progress, or maybe it was already coming, but with trauma of the brain affect it and make it worse or cause it to come on sooner?
Okay.
Such as a fall or hitting your head or,
Okay. So let me start at the top. So there are several different types of dementia. Alzheimer's is the most common one. The terms are used interchangeably, but all dementia is not Alzheimer's. All right, but because it's the most common one, the terms are used interchangeably. All right, I hope that makes sense. Yeah, all right. I'm glad to hear that your mom did well with the coconut oil. And again, like I said, look, there's a lot we don't know about this disease. So it could be that, with certain forms, the coconut oil is beneficial. I gave my mom coconut oil for years. I don't know that it did anything. So I think there needs to be some study about it. Hopefully one day in medical science, we will start to spend more time looking at these more natural approaches to disease. Right now, in general, if you're speaking to a traditionally trained doctor, it is not likely that that person is going to encourage you to do these other things, mainly because most of us don't know anything about it. And then many of us don't believe that it could possibly work, right? Because all we know is this is disease, this is what's been studied, this is the medication. If it's not a medication, we don't know what to do with it. In terms of brain injury, yes. So traumatic brain injury can in fact increase the risk for dementia. But it's important to understand that not every, let's say, not every blow to the head causes injury to the brain, right? So, but the simple answer is yes, traumatic brain injury can in fact increase the risk for dementia.
Okay.
And in some cases, in some cases, the repeated injury is what's really bad. So when I spoke last time, I mentioned, for example, football players who are repeatedly hit in the head, having, concussion after concussion. That seems to be particularly bad. Yes.
Okay.
Thank you so much.
While
Yeah.
we're on the subject of the coconut oil, somebody wants to know, at least two people want to know, how much to use? How did you use the coconut oil for your mom?
Okay. Well, I started with a teaspoon initially, and then I read that a tablespoon is okay. But I tend not to give her that much at a time, But also, it may depend on the kind of coconut oil, because I get the unrefined one from, because I have been using it over the years. So I get the unrefined one from Trader Joe's. And so that's the one I use.
Can I say something? Because I noticed we're just saying coconut oil. Specifically for that condition, it's actually the MCT coconut oil that has the medium chain fatty acids.
Oh, okay.
And not going to the store and buying the organic coconut oil that we cook with. And I find a lot of persons, because they hear coconut oil, that's what they're going and doing and just taking that one. And that one has both saturated and unsaturated fats.
Mm-hmm. Okay.
Okay. Sister Cook also has her hand up.
Oh,
Could
no, I
you
meant to
unmute and
put that down. I'm sorry.
He's the one
Oh,
that did.
that's you? Okay.
Yeah. Okay.
I'm sorry. Also, thank you, Dr. Ephraim, for that. And also, I wanted to say, even if you want to use a natural treatment, and even if your doctor doesn't understand it, you all, especially in individuals with these chronic diseases and on other medications, please at least ask the medical provider about using this. You may decide to do other than what the person has said, but you want to make sure there's no obvious interference. So, it's easy to kind of, decide I'm going to run out and get B vitamins, I'm going to do this, I'm going to do that. You could actually get the person into trouble. So yes, be careful with that.
Okay. Somebody wanted to know if it's MCT. It's actually MCT coconut oil.
Yeah, what is MCT? Because I thought initially that was something having to do with marijuana. And so that was one of the reasons why I didn't get the one with the MCT, and I don't buy anything with MCT, because that's what I was initially hearing MCT had to do with. But if somebody could explain that to me, that would be great.
Buried Treasure, that carries all natural products, they have the MCT coconut oil that is medium chain fatty acids, not with no marijuana or any drugs or anything of that nature.
Okay, so you're saying medium chain triglycerides?
Yeah, medium chain fatty acids, correct.
Okay, okay.
Please remember to consult your doctor before making any lifestyle changes. Thank you.
Okay, we have another question. Can neurofeedback, the feedback or feedback therapy help?
Okay, I'm not sure that I know what neurofeedback therapy is. I have not heard of that before. I've not heard of it in association with dementia as being a means of helping that condition.
Okay. What time is it? Okay, any other questions? Ladies and gentlemen?
Yes, I have a question.
Go ahead.
Excellent presentation. Thank you so much, Dr. Robles. Is dementia just like an end of life kind of thing? Are we all going to get it? And I know you want to talk about prevention. So when I try to follow the 8 laws of health, I don't get it every day. So like I might still skimp on my sleep, not get my whole gallon of water. Like which one of those like really would help you keep your brain together as you age?
Okay, so dementia is not a normal part of the aging process. So no, everybody is not going to get it. We discussed what, some of those risk factors are for individuals. We mentioned people with diabetes, hearing loss, individuals with dementia, traumatic brain injury, smokers, alcohol drinkers, all of those increase the risk for dementia. Medical research is now showing that 40% of dementias can be prevented by healthy lifestyle choices. Specifically, they speak about sleep, diet, and exercise. But it's important for us to always think the 8 laws of health are not a buffet where we choose which ones we're going to follow. Optimal health comes from following all of them. None of us is 100%, but our goal is to do the very best. And so I would never suggest one over another because they all play their role. And even though medical research is not necessarily, including water, we already know how important water is. Medical research is not talking about vitamin D and dementias, but we know that vitamin D has been proven to be hugely important for a healthy body. So ideally, we would just want to do our best to follow all of God's laws to the best of our ability.
Amen. We sometimes don't get it right. Sister Vera, you are not alone.
Not
Some
at
of us
all.
don't get it right. Like at this time, I am struggling with the rest part, which is very important in averting dementia and Alzheimer's, by the way. But I just don't get it right. I don't get everything right all the time.
Yes, yes.
We have a Sister Marlene. Can you unmute yourself and share with us your concern?
Yeah, thank you for taking my hand. I'm sorry I came on late, but I just have a question. My memory is getting really, really bad. My day-to-day things that I do every day at work, I find myself not remembering the name of the things that I'm supposed to do. And I was listening to a doctor who was talking about the signs of dementia. And I know you said it's interchangeably, it's being used with Alzheimer's. and I was experiencing the tremor in one of my hand. It was moving fast. So there are a few things that I was experiencing, which was kind of nerve-wracking because I'm only 60. And so I know I'm like trying to see what I can do, where I can go as to try to prevent it, because I'm thinking that's what it is. I'm preventing it from getting worse. Any suggestion on that?
Okay.
When I talk to my doctor, she just thinks that it's the everyday stress that's causing it.
Okay. So that may be correct. It may just be stress. However, if you feel that the doctor hasn't adequately investigated your concerns, then you need to get a second opinion. Go see another doctor and see if that person also thinks it's just occurring because of everyday whatever. Since you're having a tremor as well in one of your hands, it might be good if you could see a neurologist, but sometimes you can't do that without a referral. So I don't know where you are and what your situation is, but that would be my first step. Getting a second opinion from somebody who's not part of the same hospital system where you're being seen now, because you don't want somebody to be influenced by what they've read in your record.
Right.
Right. There are a number of conditions that mimic dementia. And so that's why when these symptoms appear, it's important that you be properly evaluated to ensure that it's not something else that would be treated in a completely different way.
Okay. All right. Thank you. Thank you.
God bless you, my sister.
Thank you.
You
too.
know, Dr. Robles, I saw firsthand, I had a patient the other day, she's like 58 years old, and I saw firsthand the trauma and the frustration that people go through when they cannot remember things. She came to the hospital all the way from, I work in the Bronx, and she came to the hospital all the way from New Jersey, where she was admitted in another hospital. No one knew how she got there or anything. She's 58. Eventually, I spoke to her. I was able to, we were able to get a hold of her daughter. And the daughter told us that she doesn't know how she got over there. Meanwhile, the daughter lives all the way in Jersey City. And then when you try to ask her name or anything, she just kept on holding her hair and tried to pull it out like, where's this place? I don't know where I am. And it was like just so sad to see. And then when her daughter came next day, she didn't know who she was, but she was only 58. So, my heart just went out to her because I could see and feel the frustration that she was feeling because of her condition.
Dementia is a very, very hard disease. It's hard on everybody. The person suffering with it, all the loved ones, everybody suffers through this. As I said earlier, I hope that some of what was shared today just helps people handle this very difficult condition a little bit easier. Yeah. And as I said before, there's a certain segment of individuals who have what we call early onset dementia, and they start doing this kind of thing in their 50s, and that's tough.
Yeah. I saw how tough it was for her. But the daughter was very patient, which is what I admired about her. She was very, very patient with her.
That's good. That's good. Yeah, makes things easier for the mother too. If everybody else stays kind of calm and patient, it allows her to feel a little more relaxed in spite of what's happening. Yeah.
Sometimes that can be difficult though, depending on who the caregiver is.
It's very difficult. Especially when it's an escalating situation, it's a progressive disease. And you're talking about something that can go on for years and years and years.
That's true.
Yeah.
And you just have to wait until the brain shrinks enough for, them to just finally leave this. Sister Gladys Smart, you have your hand up. What did you want to ask, please?
Oh. Where is it?
Sister Gladys?
Just a moment.
Oh, yeah, she made a mistake. All right. If there are no other questions, we
Okay,
thank.
I am here. I was trying to
Okay.
get in. I wasn't there, Dr. Robles, when you started the thing. I was working, and it was at the end of your presentation. So I don't know what was said really. Most likely, as I told you online, they had a series of depression, anxiety, and dementia secrets recovery protocol that they were having. And when I came home, I saw that for Alzheimer's and depression, they have types of triggers, like they said, Lyme and co-infection. For example, they talked about lemon, eucalyptus, lavender, things like that, molas grass, natural tick repellent recipe like neem, like lemongrass, citronella, rosemary, and also other factors that are trigger. This is mold. If somebody has mold in their houses, this can trigger Alzheimer's and dementia. Also, heavy metal toxicity are very damaging to human cell. They said also that EMF and EMR, there are many studies suggesting that electromagnetic radiation, including those with Wi-Fi, cell phones, and Bluetooth, may be stressors to the human body and trigger an immune response. They said also parasites, leaky gut, intestinal permeability, fatty liver, genetic expression like allergens, and pharmaceuticals. They said virtually every pharmaceutical is going to have an inflammatory response on the body. This is because most pharmaceuticals are synthetics, petroleum-based and toxic to the body. Mental, emotional stresses. It can be poor diet. It can be GMOs. So GMOs food. Other things, everyday chemical exposure can trigger that. It depends on the kind of work you are doing. Steps, processes for discovering your triggers. And they have all these things, studies, medical tests that you should do, like auto antibody test, inflammatory and organ function test, the organic acid test, or OAT, is a tool to find many diseases which other techniques cannot. So the past pointing test. So all of these things, and they give the reference of what they are doing. Ensuite, they have the module gut and microbiome restoration, diet and nutrition, to how to restore the gut of the person, and all the things that the person can take to. And after that, they have to cleanse the person. They have a parasite cleanse protect protocol. They have all kind of heavy metal mold detox protocol, heavy metal toxicity protocol, how to detox those people, and how to use cilantro as a chelation pesto, inflammation protocol, and nutrition. And all these doctors, they had a very good, I didn't have the time even to see all these things online. So I ordered it. The books are there, but I didn't have myself to too many other things. I didn't have the time to go through them, but it was just to share a few of what I see that was online and that people are talking about. If somebody heard of that and see if their house have mold in the, and you can see if you can expose your parents from less EMT and from mold or from parasite, have your parents being cleansed. All these things also are important in someone can, walking is very good. They have mushroom, certain type of mushroom. They are, in all of these things, the 8 laws of health come back, and this is what they are using, plus the knowledge that they have how to cleanse the person from the cellular level. Not only you cleanse the gut and things, but you cleanse the person also from the cellular level, and they use fulvic acids and other stuff that they are using. So that's
Right.
what I can say.
Okay, so that may be great information. I don't know anything about these, and if you go to a traditional allopathic doctor, he or she is not going to know anything about this. This is the kind of thing that you would need to discuss with a naturopathic doctor who has studied these kinds of things. I can't even speak to whether or not, you know, what the studies have been and what they show in this area, because that's not my area of specialty. But by all means, if you're interested in knowing more about these kinds of things, like doing detoxes to help and those kinds of things, speaking with a naturopathic doctor is important. I still maintain that your primary healthcare providers need to know what you're doing, because especially if you are on any medications, just because something is natural doesn't mean it will not interfere or have an adverse reaction with medication that you're taking. So anything that you're going to do is, needs to be done carefully and with knowledge. Okay, so just want to remind you that we're not trying to diagnose or treat any conditions here, but by all means consider talking with someone who's knowledgeable in these different naturopathic treatments. Thank you, Dr. Smart.
Okay, thank you so much, everyone, for attending. We have to end now. Dr. Ephraim, can you close in prayer for us, please? Thank you, Dr. Robles.
Thank you.
Let us pray. Dear most kind and merciful Father, we thank you so much for this beautiful Sabbath day, dear God. Father, we thank you for all the information that was received. Father, I pray that each one of us will take the education that we have received and make sure that we do not go and make sudden or rapid changes in our lives, but remember that we should consult whomever is our provider. Father, I pray that you will continue to be with us all, and that as we leave this platform, that we will not depart from your presence. Bless all of the families represented. Continue to be with Dr. Robles. Continue to give her wisdom, knowledge, and understanding, dear God, so that she can continue to share her knowledge and educate your people. So bless all of the families represented. Bless them all in a special way. And there, Father, I pray that each and every one will continue to hold on to you, especially in these times that we are living in, until you come, that each one of us can hear, well done, thou good and faithful servant, enter into the joy of thy Lord. Continue to be with us. Help us to have a safe and blessed week until we see each other again, right here, same time, same place. In Jesus' most holy and worthy name, we pray with thanksgiving. Amen.
Amen, amen, amen. Thank you all for coming. Until next time, thank you, Dr. Robles, for your very informative presentation.
Yes, it was a blessing. Thank you.
Anytime. Okay.
Thank you, Doctor, from St. Vincent. Really appreciate the information.
Bye, everybody. Courtney. breakout room.
We're thrilled to announce part 2 of the highly anticipated Curing the Incurables virtual course. If you're passionate about creating herbal formulas and tinctures to overcome incurable diseases, look no further. In just 8 days, we will provide you with the knowledge and tools to do just that. Gain advanced strategies and insights to conquer seemingly incurable diseases. Join us for the Curing the Incurables Part 2 virtual course, hosted by Daily Health and Eden's Nutritious Treats. From November 5th to November 12th, 2023, dive into the material from 6 p.m. to 9 p.m. nightly. Don't miss this exclusive opportunity. Secure your spot by clicking the link below before registration closes. Our esteemed presenter, Mammon Wilson, has over 40 years of experience in medical missionary work. He has captivated audiences worldwide with his health talks and training. As a gospel medical missionary, he leads the renowned Centurion Bible School of Health, along with a prominent lifestyle center. Mammon Wilson's groundbreaking natural cancer regimens have earned him a stellar reputation for assisting those facing terminal illnesses. Experience the same intensive training that medical missionaries paid thousands of dollars for, but at a fraction of the cost and from the comfort of your own home. At the Curing the Incurables Part 2 virtual course, you'll learn how to formulate herbal mixtures, tinctures, poultices, and ointments, techniques to reverse uncontrollable blood pressure, methods to heal diabetic sores, strategies to stop bleeding that leads to death, complete training in hydrotherapy treatments, captivating live demonstrations of natural remedies, bonus insights on setting up your own wellness home center and ministry. So, what are you waiting for? Register now to secure your spot by clicking the link below. Invite your friends and family to join you on this life-changing journey. We look forward to meeting you there.
Hello, everyone. Good evening. I just want to find out if there's anyone on the platform who has not registered for this seminar. It's about time. Time is running out. So if you have any questions, you can ask me. The cost is still $199, but even at the door, it's going to be more. So if there's anyone who would like to register, I would say now is the time, because the time is running out shortly. It starts next weekend. So is there anyone on the platform, or do you know if anyone who would like to register? There is still time, and it's still going at $199.
Hi, can I ask the question?
Go ahead.
Okay, so the incurable is all day on Sundays?
Yeah, go ahead. I didn't hear that.
The course is all day Sunday is all day
Yes.
on Sunday?
Yes, and we're gonna have Sunday, we're gonna have, oh my, it just slipped me. Yeah, we're gonna have all day Sunday. And if you're in the Brooklyn area, you can attend our session, although it will be streamed also.
No, I'm not in Brooklyn. I'm in Bermuda.
Oh, okay. It will be streamed.
Okay.